Hi, Dr. Ingve. This is Austin HagEstad. I'm Michelle Turner. You probably know of me. Some of my clients have seen you, including Austin, a movement lesson, but Austin's here, and I just thought I would show a quick video of where he's at. What? You want to say hi too? Say hi, Dr. Ingve. Hi. Hi. Oh, you got it. You got it.
Say hi. 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 Elephant. Elephant.
There you go. Okay. We'll do the camera too. I'll show you. I think what you can see straight off is ever since the surgery, what I'm thrilled about is his chest cavity is so much better. You don't see the deviation like you did, the curvature of the spine. And sideline, this is where he's at. He's fine, he still likes to move, roll around more so through the head. But see, when rolling over, he can keep a nice, basically straight torso. This is still where this leg presents in the side. I've always said, I think neurologically he acts like this leg is more like an arm versus a leg, because he's much more inclined to keep it bent, not because it's restricted, more so I think more because that's comfortable. My biggest question has always been I think more so the torque in the foot here, that pulls on the hip more than anything else. Because even in straightening, when you go to straighten his leg out, the leg still wants to present in and come in more so than the leg itself. So the foot is where, you know, if the further SPML or conversation needs to be done in his foot area. But just to show you where the leg is at from the side, I'm moving you around, big boy. We're doing a demo video. We're doing it for Dr. Ingve. Come on. Oh, my goodness. So this is where his leg is presenting from side position. And again, I can straighten it quite nicely. So this is how he's rolling, because now he wants back on his belly. Hold on. We're not done yet. 1 minute. So this is where, again, in play, he's pulling up the leg. But again, as you can see, he's trying to be functional with it, more so that he's contracting it to protect it. But any of this, again, you'll see it's just right in here that he's doing this. And just so you can see where he's at, if I'm putting my hand through his pelvis and moving. Now again, he wants to roll over, so he's engaging it. But if I bring his leg down, here, I'm actually...
It seems to force his back to arch when you pull his leg down.
Yeah. So here, leg straight. So he's got that going on. But it's right here where you'll see that knee come over. But here you can see bringing the knee in relationship to the hip around. With this, he's quite well with. If I straighten the leg, much harder for me to rotate the leg around, whereas if I can here, if the leg is contracted and released. Now you can see here the hesitation that he has when I'm bringing it straight. No problem here, but again, chest cavity nice and straight. If I bring him down here or here, but see, once he's there, he's quite nice with it. But the foot, no, I can't even present that as straight. He clubs a little bit down at the ankle. But I also want to show you on his belly just how nice, and again, how neutral his back is doing, I feel. Okay, I'm flipping you all the way over. All the way over. I'm bringing you over this way towards the camera. I'm bringing you over to the camera. What? So even though he looks a little bit twisted here, as you watch him, when he brings his head from side to side, he's not, he's quite, there you go, he straightens out. He really has an even head turn from side to side. I'm not seeing where he's got any kind of muscle tension going from this to this. So again, come on, you normally would do it back and forth. Look the other way, Austin. There you go. So see, scapula's all that stay within same range. So the leg lengths are presenting substantially different at this point where he's going at. Again, with the complex curve the way he is, he's down here as far as the knee is bent because the head's going to the other side. But you still can straighten out the leg nicely. You will see more here. Okay, so now head's the same side. So where the hip still wants to stay up a little bit higher to get this full presentation. Sorry, can you just take that that paper off? There we go. I'll re-edit around it. No, that's okay. But if you actually contracted your foot like this, there's no way you'd be able to straighten the leg. So I'm not seeing, again, where there's a tightness at all through here. It's the foot that is more my concern. I think that the foot has much more of a conversation on the hip than people like to say. Again, I'm not seeing any hamstring tightness. Yes, there's a little bit, but I think to bring it all the way back, that's where the foot conversation comes in. And my always conversation is there a way of, again, through the SPML or some other procedure to look at what is causing such a conversation here? Is it an extra bone? Is it an extra, the way the ligaments have defined him? Because, again, I can wiggle his toes and stuff. I'm not seeing that it's, quote, tight. I just think it's the way Austin has presented himself and the way the leg lengths are going. So from behind, just showing pelvic rotation. So if he's here, how he presents knee up and knee down. Oh, you don't hear knee up and knee down. So I'm not seeing anything where he has an issue more bilaterally. But again, you can feel it right here when he comes back, that foot's contracting. I'm not seeing where the leg is, where there's contractions. It's much more where the foot and how that presents. So this is where I'd really love to get a conversation on. So there you go. I thought that would help you out with conversations that you're having with the HagEstads on as far as where he is with the hips and what he needs. Thank you.